Namaste. We shall begin the session today. Today I'll be discussing mainly because regarding ADHD, that means the attention deficit hyperactive disorder. It's actually a disorder where the children are usually facing, and many of us would have seen cases or conditions, or might be having children who are having this issue with us. So, understanding ADHD is very essential. Only then we will be able to have a proper Ayurvedic management. So, during this session of 1 hour, we'll be having an outlook regarding how are the symptom manifestation of ADHD and in an Ayurvedic view and its management through an Ayurvedic method in a nutshell. So first, there are three main cardinal symptoms, so main symptoms regarding ADHD. So these are the main domains, and there are various symptoms coming under these main headings of ADHD. The first one is inattention or inability to maintain your attention span into one thing. That is the first thing. The second domain is impulsive domain, where impulsive is there is a quick response. Usually children are quick or fast in response, but here children with ADHD will be having a tendency for having more quicker response than thinking before action. So the thinking activity for them will be very less, and the responses either in activity or in speech will be faster than usual. So the third one is hyperactive domain. Hyperactive domain in the sense here the child will be having, if ADHD is there, the child will be very active or more active than the usual. Children will be always active, but here it will be just like on the toe, on the go. They will be just always moving and restless, not sitting idle, and it will be very difficult and problematic for the parents or the caregivers to handle them, to make them sit idle in a place. So these three domains, though they are there, but usually we believe that ADHD is a symptom or a disease which is pertaining only to the childhood. But it is not so, because recently, might be for past 2 years or 3 years, it has been noticed that it has been identified that this is a disorder which continues throughout the life of a person. It can be identified or early diagnosed by childhood, and if not managed or properly contained, it can continue to adolescence and adulthood. And the issues of ADHD will be affecting both adolescent as well as adults. And at times, even now, diagnosis of ADHD occurs at adult age also, because it goes unnoticed in the early stage. So, early diagnosis of ADHD is very essential for providing a quality of life for the patient as well as for effective management. So, that is why in this promo webinar session, we'll be handling the earlier understanding base level of ADHD symptoms. So, the first one is inattention domain. We'll see that in detail so that we can understand in the second phase as an Ayurvedic view. The main symptom of attention domain, which we need to check out in children with which the role of ADHD will be difficulty to keep mind on a particular task. Usually, if you're giving the child something to be done, the child will not be able to continue that activity for a long period. They will have breaks or they will take breaks in between, and they will switch on from one thing to the other. So, if you ask them to do something, they will drop things in between and go off. If you ask them to do the schoolwork, they may not be able to complete one page at a stretch. So, a task which is assigned for a child, if the child is not able to complete it, even after authority gives proper instruction, that has to be observed for inattention domain of ADHD. So the second thing which we need to consider is how easily they are getting bored. Children, if you should never assess this regarding the studies, because studying was always a boring activity for children in usual days. But there will be few children who are having an aptitude towards study or intrinsic motivation towards study, but in other things, it can be games or it can be some other things where involvement is required, and they are getting bored easily. They are not able to continue it for a long. Even it can be television. If you make the child see the television, child is not able to see one cartoon or one thing for a long period. They are shifting from one to the other. If they are not continuing for a time, and they say, I don't want this, I need to change the channel, change the video. If they are keeping telling this, that is something falling under the inattention domain. The other thing which we can observe in inattention domain is the child is not able to follow instruction. If it is a long phrase telling you should do this, after completing this, the child will not be able to follow the sequence. The other thing, the child will forget the instructions. The other thing, the child will not be able to give attention to what we are saying when he is doing something else. So that instruction following activity will be affected in a child because that attention span is less in ADHD. So the last thing, there are various symptoms as per diagnostic guidelines, but these are the base things. And the last thing which we need to always think is child, if returns from school, easily forgetting things. He forgets his school text, notebooks, pencils, erasers, everything, or he loses things often. He's not able to organize his things, think that what all are his belongings, put it back, pack them back to his bag and come back. He forgets them. He loses things. We'll have to purchase pencils every day, every new thing every day. If that repeats in a pattern, then we need to have a look into the inattention domain of ADHD. So the next one is the hyperactivity domain. Here, what we need to think is the child is restless. Restlessness is the cardinal feature of hyperactivity domain, where the child cannot sit still or idle in a thing by doing one particular game or activity or one thing. So the child is always on the go. Like he's ready for another thing. He's always in the moving stage. So usually children will be active. They'll be playful. How do we differentiate it from hyperactivity? The main thing is the child will not be able to sit in class when he is not having any interest in something which is being taught. So irrespective of teacher being teaching, child might be wandering in the class. One thing. Second, even if at home, the child will not be able to sit and do activity, either listening to stories or staying and waiting for his turn. He won't be able to sit.
Okay. Could you please...
Were you able to listen the explanation of the slide?
Yeah, could you please continue from the part about listening to stories and some sitting activities like that?
Okay. The child will not be able to listen to stories or wait for his turn by sitting in a place which is being idle. So he will be moving or roaming around even at home also. So the other thing is their hands. Hands is the main thing of psychomotor activity. Psycho is the brain activity, motor is the physical activity. For them, hands will be always fidgeting. Fidgeting is they was either doing flickering activities or touching things or sitting, making sounds with hand or ticking sounds or moving the legs. So such type of limbs will be moving in a restless way, usually in a child with ADHD, if the hyperactivity domain is more. So the third domain is impulsivity domain. So how do we assess the impulsivity? Here, the child will not be able to have a proper control in his words or speech. Usually children blurts out things, but for a child with ADHD, his comments will be always inappropriate. It will be very rapid, very speech, and he will not be able to distinguish whom am I speaking to. Is it my principal? Is it my teacher? Is it my mother? Or he won't be able to distinguish who the person is there in front, and he would be giving rapid replies. It might be absurd, or inappropriate to the situation. He or she will not be able to think of the consequence of his talk. Like if he says something, is it emotionally hurting the other person? And is the other person in front of me in an emotional state, or is she suffering? Such type of understanding of the person whom I'm communicating with will be very less to a person with ADHD, either in childhood or in adolescence or in adult. So for them, they won't be able to think about the consequence of the action. So here the main issue is the brain's frontal lobe or the logical center is usually not properly developed as per the age. For them, the emotional brain or the rapid responding brain system and the activities are being more active. The logical centers are properly not developed in children with ADHD. So, based on these symptoms, it has been categorized in diagnostic guidelines as 3 types. The first one is predominantly inattentive type, where attention domain will be more affected. The second and third is predominantly hyperactive type, and the third is the combined type. Predominantly hyperactive type, you will be having mainly of the hyperactive domain symptoms, and the inattentive symptoms will be very less or nil. In inattentive domain also it will be the same. There the inattentive domain symptoms will be more and hyperactive domain symptoms will be very less. So in that way we can categorize ADHD as either of inattentive domain area or hyperactive domain area, or in a combination of these two where symptoms are mixed. Here, the main thing is if we need a proper diagnosis of ADHD, as I mentioned before, children are usually active. Children have a tendency of not having attention. That is the basic nature. So, for a proper diagnosis, we should have those symptoms persistent for minimum of 6 months or more, and all the symptoms should be affecting the social functioning, the relationship, the academic performance, or if it is an adult or adolescent area, their occupational functioning should be affected. Only then we will be able to diagnose this as ADHD. So the impact of it, usually it will be having an impact in the academic area if it is in childhood, and academic performance if it is getting very less. It can affect the self-esteem or self-conception of how my image, my personality. Okay, I'm not a proper person having qualities to study. I'm having scholastically backward ideas. Such inferiority complexes might build up in children. So it will affect the self-esteem. So academics will be affected. The self-esteem will be affected if ADHD is undiagnosed in childhood area. When the child having an impulsive way of communication with others, when he's not able to understand the other person's emotion, it will be having a trait in his relationship, how he maintains the relationship with his parents, his siblings, his friends and elders. So cordial relationship or healthy, sincere and deep relationship will be very less in having children or adult or adolescent with ADHD issues. So since the hyperactive domain is high in those children, they'll be having reckless injuries of falls, of being born issues or anything due to accidents without seeing how the proprioception is, how the sittings is. And also once they are in an adolescent or adult age, if they start driving, they won't be having a proper care and coordination in driving, and it can lead to impulsivity and hyperactivity, can lead to accidents due to racing character or over racing or over speeding. So if this is not corrected with therapies or treatment, it can carry on to an adolescent and adult age. At that time, the person with ADHD will be aware that he will not be having a proper attention span. He's not able to focus in his work. He's not able to focus or sit idle and do his job. So what he will depend will be either smoking or substance abuses, which will create an anxiety response calming down, which can provide him an attention. So people with ADHD have a tendency and more probability of having substance dependency or smoking habits to reduce the symptoms of attention issues and hyperactivity. So, due to their reckless and hyperactive behavior and not following instructions from authority, they tend to have legal issues by violating laws because they don't properly pay attention to instructions. So, legal law violation and related issues are more common for ADHD, adolescents, and adults. So here what they require is a proper balance between their logical brain and their emotional brain. Brain is a brain main center where the body's motor activities, neuronal activities, everything is being connected. And this brain itself has an emotional aspect, emotional brain, where this should not overrule the logical brain of frontal cortex. So heart brain balance or the brain's two area balance, that means a balance between the emotional brain and logical brain is basic requirement for ADHD. So if we understand the symptoms, we'll be able to understand in a Ayurveda dosha basis. We all know that there are three doshas, Vata, Pitta and Kapha. And among these three doshas, the mobility aspect is mainly attributed to Vata. The stability aspect is attributed to Kapha. And also the sensory control, sensory perception, everything is mainly attributed to Pitta. So understanding ADHD with Tridosha aspect is required for the easy management of ADHD. So the first set of inattentive domain dominant area symptoms, if the child is having that area of symptoms are more affected, we need to see what ratio of Vata and Kabha is basically involved in the child. Because that we'll see in next slides. Vata Kabha dominant symptoms will be more in inattentive perspective of children. And in hyperactive domain area symptoms, if that is more, purely Vata dominant areas. If we consider the three doshas, Vata will be having the major dominance in a child with more of hyperactive symptom. If it is the child is having more of impulsive domain, as we have said before, since the sensory regulation, sensory perception, everything is Pitta associated, Vata Pitta dominant symptoms will be more in that area. If we see Pitta Unmada or Paitiga symptoms of classical idea references of insanity, we can see that hallucinations, such type of symptoms where senses are involved, is usually Pitta attributed. So impulsivity domain active ADHD will be having usually Vata Pitta dominance. So first we'll see how it is inattentive domain in Vata Kapha dominance. Kapha will be always having an association with the Tamo Guna or Tamo Dosha. When Tamo Guna of mind gets vitiated, it can transist into a stage of Tamo Dosha. Then the Kapha Dosha in a person can go associated with the Tamo Dosha, causing Ajnana or ignorance. So here this inattention is mainly occurring because of not having a proper logical brain area. Logical brain is jnana, that means where there is clarity. So that ignorance is occurring by the avarana or a delusion or a blockage by the kapha. This is being triggered by the vada which is dominant in the person. In vada, the main activity is chalatva or this is the thing which makes the child's brain shift from one object to the other object, not able to sustain the attention, is mainly by the chalatva or increased mobility of vata. Then the other thing is the asthirada or the unstable nature of the vata. This is also triggering the inattentive domain where the child will be shifting from one task to the other. So this shifting, this fluctuation is mainly due to the vata kapha dominance occurring there. So the next is vata dominant of hyperactivity. In hyperactivity, chalatva or the restlessness will be very more. Always ADHD will be a tridosha dominant one, but here in hyperactive domain, here chalatva or restlessness will be the main thing which is high, and their motor activity will be very high. So the third is the impulsive domain. In impulsive domain, basically here we need to see that the pitta is the thing which is being associated with vata here. When pitta and vata is having laghu guna, they will be stimulating the rajo dosha of the manoguna, manodoshas. So among the tamo and rajas will be more involved in vata pitta dominant impulsive domain of ADHD. Because pitta and vata is having a lagutva and tikshna guna of pitta will trigger the agni amsha in rajas, and it will be more vitiated in impulsive domain of ADHD. So here, as we have seen in symptoms, in impulsive domain where it is more active, the child will not be having a control of emotion regulation in his speech. He will be blurting out the comments inappropriate to the situation or the person in front. This is mainly because the quick response of Tikshna of Pitta. It is very fast. It is not having a stability or sthirada of Kapha. If Kapha is there, we will be able to analyze, we will be able to think, because Kapha in a guna stage of a normal stage, if the element is there, Kapha will balance the impulsivity of Vata and Pitta. But that is very lacking here, and that is why the inappropriate comments will be more in case of impulsive domain of ADHD. So how can we manage this in a brief? This is basically the basic idea of ADHD. Since it is the initial webinar, I'm not going in detail because this time frame will not be able to enlarge it in the main extent. This is a detailed one, the management. So in ADHD, if the doshas has to be handled, one thing we need to assess which dosha dominant or which domain dominant child we are having as a patient. And in that, the first thing we need to correct is the acne, because it is from the metabolic digestive phase of our gut or the acne correction that the dosha formation is proper. Second is the tarpana or nourishment level, and the third is throdoshodhana or clarity level. So these three are the main management lines in ADHD that we can see in detail in next slides. So in acne correction, we'll see the basics. If I'm telling the drugs, if I'm telling the condition specific, it will be very detailed that we can see in the main sessions. So the first line will be AMA or metabolic correction, because AMA correction or Agni Deepana Pachana or metabolic regulation is essential because Rasa Shuddhi or the first formed element of digestion, the rasa, clarity should be made so that the dosha formed will be very proper. If kabha issues are there, kabha if there is blockage, the first correction should be ama and rasa. If that is not corrected, attention span will not be increased. Blockages of brain's activity will not be corrected. So first line will be always Agni correction for Ama and Rasa Shuddhi. when you're correcting the rasa or the first dhatu, the best result will be the form of kapha and pitta will become clear. There'll be rasa shuddhi and kapha pitta balancing. And the derailed vada will be coming to a analomana stage where thought process becomes clear and the attention span increases. So gut brain axis is the first line of correction in ADHD. So the second one is tarpana, because it can be done externally as well as internally. It is mainly focusing upon reducing the initiated vada pitta dominance or vada dominance. So whichever is high, we will be selecting the drugs, we'll be selecting the medicines. So if it is required as external, like abhinga, dhara, etc., that will be prescribed. Or internally as medhya rasayana or rasayana therapies, that will be provided based on which is dominant. Is it vada, is it pitta, or is it both combinedly increased? Tarpana module will be selected. So third is the Srodoshodhana. Here we clears the Kabha Avarana. As I said, there will be a blockage of Kabha. We'll be doing the initial one in Amapajna, also the same line. But here, Srodoshodhana measures will be either Nasya, Virejana, or Pajna procedures. So that will be therapeutically Srodoshodhana. That will be more stimulating for attention improvement. So this is a baseline of understanding, and in all conditions we'll have subtypes. In subtypes, management will be different, the drugs will be different, and the selecting methodology will be also different. So that conditions, everything we can detail in the sessions which will be there in future sessions, like in the course as such. Since it's the baseline webinar, we'll be dealing the nutshell of the management here. And the online course will be on children's psychology and psychiatry, where both angles will be handled. And this session will be handled by me in a mixed form as such, because few will be pre-recorded ones and you'll be listening to the recordings, and you can clear the doubts later in few sessions. Because my health is in a situation where I'm concerned, I'm in my pregnancy period, and next month is my delivery. So I'll be having a few gap in between. So we'll be having the recordings done for a few sessions, and the rest will be providing to you as online. So it's a mixed version this time. So we can think about the session and the detailed ones in the fewer next classes and sections. So shall we do the discussion as a mixed format, as you can send me the questions? Is that okay, or should we discuss now, or shall we do?
I think we'll decide in the future. I think we can see what exactly are the questions there.
Okay, so you will send them to me.
Okay, we'll see. We'll see about that.
Okay.
Okay, thank you very much for today's lecture.
Okay, thank you.
Dr. Thushara, bye.